and welcome to Balanced Health. I'm so glad you joined us today. I'm Shirley Rose, and this is Joe Costello. You know, in a previous show, we talked about the importance of sleep and what you can do to get a better night's rest. However, many Americans suffer from sleep disorders, which means they need medical attention. Today's topic is sleep disorders, and Andrew Mouton has joined us to cover this topic. Dr. Mouton is a licensed clinical psychologist and board-certified sleep specialist. He practices in Illinois at the Center for Sleep Medicine. Thank you so much for joining us again on Balanced Health, Dr. Mouton.
Welcome back.
It was so interesting last time. We talked about how to get a good night's sleep and that a lot of us don't. And just to kind of, in case someone didn't join us last time, first of all, what a number, what is the percentage of Americans that are affected by sleep disorders or
Well, we think that across the lifespan, the incidence of clinical sleep disorders may be as high as 50%.
Wow,
We're talking about very, very common problems, yes.
And that's adults, I would assume.
No,
Or
across the
children,
lifespan.
too.
But sleep disorders affect children as well.
They do.
Absolutely.
You know, when you say 50%, you're not saying that 50% of Americans get treated. You're saying that as
not
many
at
as
all.
1 out of 2 Americans have a sleep disorder.
At some point in their life, will experience a clinically significant sleep problem, yes.
Wow, and yet a very small percentage actually get treated, is that right?
Very, very small percentage, unfortunately. But that number is increasing, I think, with awareness of sleep disorders, more education on the part of professionals and physicians. Hopefully the number of people being treated is going to continue to increase.
And again, as a review for our audience that didn't see you on the last show, what are some of the red flags, some of the symptoms that you know you're not sleeping well, or maybe you even have a disorder?
Well, big flags for us in sleep medicine would include unrefreshing sleep, sleeping and waking up tired, being sleepy throughout the day, falling asleep at inappropriate times. Snoring can be a sign of a very common sleep disorder.
That brings us really to some of the disorders. So what are some of those disorders? And I know snoring can be just snoring, or it can be something more serious, right?
Right. Snoring can be a sign of something called sleep apnea, which is the most common sleep disorder that we actually treat in a sleep disorder center. People with sleep apnea have repetitive episodes across the night where their breathing stops, typically because there's a collapse in the upper airway. Usually we think it's somewhere around the base of the tongue, but highlights of sleep apnea, of course, include loud, disruptive, often irregular snoring, daytime sleepiness, sleep that's unrefreshing, non-restorative.
How about like abrupt awakenings or startled awakenings? Could that be from, you know, you're gagging and you wake yourself up?
It can be. Some people with sleep apnea will report waking with gasping or choking.
My husband actually, who has apnea, that he would wake up and he said it would be like a panic feeling, trying to catch his breath.
But there are a lot of people with very severe apnea who have no idea that this is happening during the night, yes.
But so far we talked primarily about obstructive sleep apnea. There's also something called central sleep apnea or central nervous system sleep apnea or something, right?
What is that?
Usually that's accompanied, that's a byproduct of more of a systemic illness, or is that a separate entity unto itself?
Well, central sleep apnea is certainly not anywhere near as common as obstructive sleep apnea. Obstructive sleep apnea involves a blockage in the airway, again, typically somewhere around the base of the tongue. The person with obstructive apnea is trying to breathe and is making every effort to breathe, but can't breathe because the airway is blocked. In central apnea, there's no effort to breathe.
So it's a brain nervous system communication
Absolutely,
thing.
certainly can be, and it's something that we see after central nervous system injury at times. We see it in patients with congestive heart failure and other conditions.
Wow.
But
How about when
much
babies
less
have
common.
apnea, as little infants? Is that mostly obstructive sleep apnea?
Well, there is something called apnea of infancy and apnea of prematurity. It's a little bit different than the adult form of apnea.
Is that where like a preemie has to be on a monitor because they stop breathing?
They can be monitored, certainly. But obstructive apnea can develop very, very early. In children, typically it occurs in association with big tonsils.
Oh my
So we see routinely in the Sleep Disorders Center young children, 2, 3, 4, 5 years old, with big wall-to-wall, sometimes they're called kissing tonsils that
Wow.
can block the airway
It's
during
just
sleep.
Just a genetic thing. They're born with them, and how do you correct? Do you remove them?
In children, generally sleep apnea can be cured with tonsillectomy. In adults, it's a different mechanism, we think.
Interesting.
Well, we've spoken primarily of sleep apnea as one of the disorders. Let's touch on insomnia. I think everybody knows insomnia means you're just not getting enough sleep. But clinically, how do you define insomnia? What are the criteria?
Well, technically, insomnia is a symptom. It's a complaint of non-restorative or unrefreshing or inadequate sleep. So it can be the result of a number of problems. Probably the most common cause of insomnia would be anxiety and depression. But you can have insomnia or unrefreshing sleep as a result of, say, restless leg syndrome, which is another very common problem. People with restless legs have difficulty falling asleep because of these very unpleasant urges in their legs that require them to move or rub their legs or stretch. And as a result, they have trouble falling asleep.
I actually have had that. I mean, it's not regular, but I have had that at times, and you just have this compulsion to move your legs. Otherwise, you think you're going to go bananas if you don't move your legs.
You can't fall asleep when that's happening.
And it does keep you awake.
Absolutely.
That's right.
So in a typical, if someone's experiencing those symptoms, they come to a sleep center like yours. Do you put them through the night, watch them sleep, and then if it's not sleep apnea, but they have absolutely a sleep disorder, would they be considered then like primary insomnia and then?
Right. If you have insomnia that's not due to another medical condition or a psychiatric disturbance, then we would say that you have primary insomnia. Right. And the treatments generally are very, very effective. The most effective being something called cognitive behavioral treatment of insomnia. While I know sleeping pills are very, very popular in our country, typically they're not indicated for chronic insomnia. The best intervention is the cognitive behavioral treatment.
Touch on that a little bit.
Yeah, what is that?
Well, we think that a lot of insomnia continues because of a learning or conditioning process that takes place when people lay in bed awake for extended periods of time. So cognitive behavioral therapy can involve such things as sleep restriction, where we limit the amount of time that people are in bed. Stimulus control therapies, where we get them out of bed if they're not able to fall asleep. The cognitive component may involve looking at some of the beliefs and attitudes or expectations that they may have that are contributing to the sleep problem.
That is really interesting.
It's
The
really
intervention is very, very effective, and the changes that result are durable and lasting, which is something that we can't achieve with sleeping pills.
And of course, sleeping pills are fine if you just have an occasional night, but not if you
wonderful,
have
absolutely.
a chronic disorder,
They're
because
the
they're
best
addictive.
treatment
right?
for a transient or short-term insomnia, absolutely.
Good.
For chronic insomnia, no.
Well, we're having a great discussion here, but it is time for a quick break. And when we return, we'll continue our discussion on sleep disorders. So don't go anywhere. We'll be right back with more Balanced Health.